Hi, I'm Tim Coombs. I'm going to be talking about reporting Indigenous mental health outcomes, the results of routinely collecting Indigenous status. In this presentation, I'm going to give you a brief overview of the National Outcomes and Case Mix collection and the two products that the Australian Mental Health Outcomes and Classification Network used to report on the collection. I'm going to focus on Indigenous reporting and what we learn, and the next steps in the development of reporting on the collection. The National Outcomes and Case Mix collection includes clinician-rated measures of problem severity and functioning, as well as consumer self-report measures of anxiety, distress, and quality of life. In public sector mental health services, these measures are collected following a standard data collection protocol across all age groups, older persons, adults, and children and adolescents, and across all service settings, inpatient, community, residential, and ambulatory, at specific collection occasions, admission, review, and discharge. The Australian Mental Health Outcomes and Classification Network has two products to report on the National Outcomes and Case Mix collection: the WDST, or Web Decision Support Tool, and the Reports Portal. I'll demonstrate both of these in this presentation. Let's look at how to access the Reports Portal. Go to the AMHOCN homepage, look for NOC reporting, AMHOCN Reports Portal. In the Reports Portal, you can look at the data in many ways across age groups. I'm going to focus on adults. Across the different measures that make up the collection, I'm going to look at the HONOS, total score, individual item scores, look at individual items, periods of care, episodes of care, or collection occasions for different financial years, across service settings, inpatient, ambulatory, community, residential, collection occasions, admission, review, and discharge, all reasons for collection, new referral, 91-day review, no further care, across different age bands for adults, across the jurisdictions. You can view by sex, you can view across different diagnostic groups, you can look at the results in terms of legal status, voluntary or involuntary, across different phases of care, or Indigenous status. We're focusing on Indigenous status. You update the table and you get a very large table of HONOS items by Indigenous status across service settings. You can download that table into a CSV file for manipulation in Excel. Once that Reports Portal query has been exported to Excel, we can show, as we do here, that we have approximately 85,000 HONOS observations on Indigenous consumers. That query can also show us the average HONOS scores for individual items between Indigenous and non-Indigenous consumers in inpatient units. The yellow bar represents non-Indigenous consumers. The blue, orange, and grey bars represent Indigenous consumers. You can see that on average, Indigenous consumers have higher HONOS scores on substance use, aggression, and hallucinations and delusions. But there is no average difference in scores for physical illness and disability problems. If we look at average ambulatory scores, we see a similar pattern, with Indigenous consumers having on average higher scores for substance use, aggression, and hallucinations and delusions. Again, there is no difference in average scores for physical illness and disability problems between Indigenous and non-Indigenous consumers. Now let's look at the Web Decision Support Tool, the other way that the Australian Mental Health Outcomes and Classification Network reports on the National Outcomes and Case Mix collection. First of all, go to the AMHOCN homepage and select Web Decision Support Tool. Go to another page where you get a bit of information about the WDST. And in the WDST itself, you can select across different states and territories, but I'm going to stick with national. You can look across different age groups. I'm going to select adult. There's different age bands there. Look at different measures. I'm going to focus on the HONOS. across different views, individual items, subscales or total score. I'll select the total score. Across different either collection occasions or change over time. I'm going to stick with collection occasions. Admission, review and discharge. I'm going to look at admissions. To inpatient, residential or ambulatory, I'm going to look at ambulatory. You can select or unselect sex, diagnosis. If they're blue, they're selected and included in the query, across different financial years, across legal status, across phase of care, and Indigenous status. And we unselect these, we'll get a report that's on Indigenous consumers. We run that query and get access to this report, which shows 3 years worth of collection on admission to ambulatory services for the HONOS, about 17,000 observations, average of 11.9, percentile distribution and frequency distribution of HONOS total scores from around 37 here to around 0 here. Running queries from the WDST allows you to see how consumers present on admission to the service, more frequently high HONOS scores, and how they present on discharge from the service, more frequently low HONOS scores. Having 2 collection occasions allows you to view what's changed over time. Here is how the WDST reports change over time. Here we report significant improvement, deterioration and significant deterioration, as well as no change. Here you have the pattern for Indigenous consumers in ambulatory services: improvement, deterioration and no change. A similar pattern for inpatient consumers with an Indigenous status. Some deteriorate, some don't change, but a significant proportion improve. We can run these queries to compare across states and territories. We may want to focus on outcomes in inpatient units. Here we can look in detail at Queensland's performance. But other jurisdictions report very different results. Here in the ACT, for example, if we look across states and territories and compare ambulatory services, we get a different pattern. If we focus on New South Wales, we can see there is improvement, no change in deterioration. How if we look to the Northern Territory, we're unable to report any change for ambulatory services because there were less than 30 observations. Any of these queries can be run for any measure in the National Outcomes and Case Mix collection. Here we see the change scores for the HONOSCA. Here we see the change scores for the HONOS 65+. And here we see the change scores for the LSP 16 for Indigenous consumers. Up until now, we've focused on the clinician-rated measures. Let's turn to the consumer self-report. Here we see comparisons across the 3 measures. We can view the K10 and its pattern of scores on admission and its pattern of scores on discharge. We can also view change over time. However, when we turn to the mental health inventory, we have less than 30 observations for Indigenous consumers over a 3-year period, and so therefore are unable to report. Reporting of Indigenous outcomes is occurring nationally. Improvement, no change and deterioration are observed for the HONOS and the LSP. Very small number of observations for some measures, particularly the consumer self-assessment measure. Some jurisdictions with potentially higher numbers of Indigenous consumers have little to report. We plan to begin reporting by social disadvantage and rural and remote status as one of our future developments. Thanks. You can learn more about reporting on the National Outcomes and Case Mix collection at the AMHOCN website.